side effects that they cause, and increased costs because a simple surgical procedure then becomes very complicated for additional costs. Dermatologists in the United States perform over 25 million minor surgical procedures annually, and you can see what they are, from shaving to excisions and punch biopsies to Mohs surgeries to chemical peels and laser resurfacing. Superficial cutaneous wounds that dermatologists usually do are low risk for postoperative infections. And the routine use of topical antibiotics are unnecessary and not recommended. And according to Del Rosso, they are a habit without evidence. And they create a risk for allergic contact dermatitis with the most commonly used topical antibiotics in the United States, which are bacitracin and neomycin. And they also put patients at risk for resistance to topical antibiotics. So because of this, we've stopped using topical antibiotics, went to petrolatum, and then I discovered this Stratamed product called, or the Stratamed product, which is the first film-forming topical silicone gel that is a semi-occlusive wound dressing that you can apply onto open wounds and closed wounds. It's inert and will not affect the surface pH of the patient. It's bacteriostatic, and in many cases it's bactericidal. It's gas permeable, it's a gel, and it's easy to apply because it contours to the wound surface and forms a protective film that's a flexible barrier. It's hydrophobic, so it does not adhere to the granulation tissue. It sits right on the top, and it maintains wound hydration and creates an optimal environment that causes fast healing to the wound, and it protects the wound from any chemical or microbial invasion, reducing inflammation and preventing scar formation. So it is applied directly to any exposed wound surfaces, whether they are acute or chronic wounds. Then you can add a dressing if you like. And we have now used it on laser resurfacing patients, chemical peels, dermabrasions, any sort of surgical wound, excisions, excisions, biopsy sites, split thickness skin graft donor sites, burns, even chronic radiodermatitis. What we found is that it reduces redness and discoloration, it relieves the discomfort of wound healing, and it minimizes the complications of wound healing. Now, the possible mechanisms of action is because it forms a flexible, semi-occlusive, gas-permeable. These are the most important attributes of this particular product. It is a protective covering that binds to the injured skin but does not penetrate into the skin. It restores the natural barrier function because it reduces transepidermal water loss at the wound site. So this promotes faster re-epithelialization, creating a barrier against external insults, chemical or microbial, and it maintains a nice moist healing environment without maceration, reducing inflammation and leading to faster wound healing and minimizing scars. Now I'm going to show you some surgical wounds, post-Mohs surgery wounds, and a lot of other wounds that we have used this product with. And some of these cases have already been reported. These were reported, these couple next patients in 2014 in the Derm Surgery Journal. So this is a patient that was 90 years old. This is 2 years later. We did a squamous cell carcinoma of his scalp, and he had already 2 delayed free thickness skin grafts, full thickness, and it just would not heal because the wound developed erosive pustular dermatosis. So we did 2 skin grafts and treated it symptomatically, and it wouldn't heal. 5 weeks after Stratamed, the wound practically healed 90%. Another patient around that same time had another large squamous cell carcinoma of the scalp. He was 89 years old. It's almost 4 months later, and still the wound was not healing. Again, there was a problem with epidermal maturation, and so 5 days later, with Stratamed, the area healed almost 98%. The areas that you see here, there's still exposed bone, and that's why it's not totally healed. Another patient, 3 months after Mohs surgery, 73 years old, we did a primary closure and was persistently open, would not re-epithelialize, and 2 weeks after Stratamed, 4 weeks after Stratamed, 100% healed. So the way Stratamed is used, and I'm going to show you more patients, give me a few seconds. You clean the affected area, remove any sort of moisture or exudate off the surface of the skin, and apply a very thin layer of the product. It's very easy to apply, it's transparent, and it just adheres to the surface and the different irregularities of the surface of the skin. And then you can put another dressing if you like, or you can leave it open. So we leave it open for laser cases and biopsies, and then we cover it with larger surgery. This is a very interesting case, and we also published this in the International Journal of Dermatology last year. This is a patient whose son came to me and said, my father has had a skin cancer on his scalp for 3 years. The plastic surgeons cannot eliminate it. The dermatologists are having difficulty taking care of it. And next week, he's going to have radiation therapy of his entire scalp. I said, well, wait a minute. Why don't you send him in and let me see what he looks like? When he walked in, this is what he looked like. And I was very, and he had 2 excisions of squamous cell carcinoma. He had full thickness skin grafts, a liquid nitrogen, and a lot of symptomatic treatment. So I said, I wonder what's underneath all this, whatever it was, this crust. So he also developed erosive pustular dermatosis. For 3 years, he could not have this scalp healed. And I suspected, this is what it looked like when I finished cleaning his scalp. I suspected that there were some either precancerous changes or even squamous cell carcinoma in these areas. So he left the office, and if you look at the dates, some of these slides have the dates. So this is November 20th, 2013. 2 weeks later, after Stratamed, the scalp was dry, it was healing, but there was evidence of actinic keratoses and some squamous cell carcinomas. So I did a Mohs surgery that went all the way down to bone, all the way down to the calvarium on 2 locations. I'm afraid of this pointer because I don't want to go backwards. Here and here. And we did porcine xenografts, applied it to prepare the area for granulation tissue to give him full thickness skin grafts, autologous grafts. But he said, no, leave it alone. So within a few months, the area healed by second intention. And there was still evidence maybe of some actinic keratoses. He left, this is July 2014. He comes back a year later, and with this wound, which was another squamous cell carcinoma. But if you look, the rest of the scalp is controlled. It's clean, it's dry, there's no problem. We did another porcine graft, xenograft. It created this nice granulation tissue. So I did a full thickness skin graft from the lateral thigh, his left lateral thigh, and it's healing nicely. This is another patient. This is a Merkel cell carcinoma. It was biopsy, and the patient wanted a wide excision by the general surgeons who convinced him. It was done in September 2014. The biopsy result indicated that there was still residual Merkel cell carcinoma because he didn't have it done by Mohs surgery, and the surgeons wanted to hurry up and give him radiation therapy. In the meantime, the wound dehisced, and now it's 3 months later, but they went ahead and did the radiation, and now it's at the end of the radiation in January 2015, and he came to me and he said, because I take care of this other general problem, dermatologic problem, I'm having trouble with this wound, it's not healing. It is now 5 or 6 months and I have this open wound. So I said, and this is before, I said, let me see if Stratamed is going to help. So I said, put Stratamed, and All during the time of this period, he was using silver sulfidine. The surgeons were applying for 3-4 months silver sulfidine trying to close a wound, and it didn't work. So I said, let's try Stratamed on the bottom part of this line, and on the top of the line, you continue using your silver sulfidine. So this is January 19th. Over the weekend, he came back. On Monday, 3 days later, the wound is healed 98%. And then we continue to use it because this is chronic radiodermatitis. It's now desquamating. And then this is another product, Strata XRT, is for chronic radiodermatitis. In the United States, it's going to be called Stratacel. This is a product that was used in Europe when I was getting it. And so he continued to use it. And after 3 weeks, the area has healed totally, and it stayed like this until today. And I have seen him since. So we have used Stratamed on areas of dermabrasion, on, this is photodynamic therapy, where we divided the face in half, used clobetasol ointment. This is the most potent topical steroid you can use, and Stratamed on the other side, and the results are equal. Stratamed showed that it's just as efficacious as the strongest topical steroid. We use it on deep fractionated CO2 lasers. As you see here, this is 4 weeks later, very nice results. Traumatic wounds that was infected with MRSA, did not heal, and we applied Stratamed in a couple of weeks, it totally healed. And these are some of our Mohs excisions, where it has a very nice cosmetic result, sort of preventing hypertrophic scars. And, I don't know if it prevents keloids, but it has the wound healed nicely. And because of this, here, I'm sorry, so one more slide. So to us, it's an ideal dressing. It's sterile, it's biologically inert, and bacteriostatic and bactericidal. It's transparent, odorless, it dries rapidly, it's easy and painless to apply and remove. It has total contact to the surface, but it's gas permeable. It's a barrier for all wound surfaces, and it protects the healing wound and promotes transepidermal water loss, and it does not macerate the wound. It reduces inflammation, and it's compatible with additional secondary dressings, any sort of gauze or tape or whatever you want to use. Has a prolonged shelf life, and it's very easy to use and inexpensive. So because of this, we approached the company and we're doing a phase 4 post-marketing study to assess infection and contact dermatitis prevalence with the post-operative use of Stratamed versus the most common topical antibiotic that we have in the United States, that's bacitracin, neomycin, and polymyxin B. So it's a prospective open label trial. It has 2 parts. Part A, it's any of the surgical procedures that we do, and we have 137 patients that are randomized to use Stratamed, and another 137 patients that will use the triple antibiotic. Part B is for all our Mohs surgical wounds, and we'll have 30 patients to apply Stratamed and 30 patients to use the triple antibiotic. So the primary objective is to see the prevalence of contact and irritant dermatitis between Stratamed and topical antibiotics, and we know that it's about 10% with this triple antibiotic. The severity of the reaction is lower with Stratamed than with topical antibiotics, and healing time should be improved, and the type of healing should be better with Stratamed. And the secondary objective is what is the patient's infection rate with Stratamed as opposed to a topical antibiotic, the patient's satisfaction with using the 2 products, the comfort level, and the ease of dressing changes. I can tell you we have used this, we're into about 40 to 45 patients. We started about less than a month ago, and I see that the results sort of reflect this conclusion. Stratamed gel is a well-tolerated in a variety of surgical and dermatological procedures. There's no allergic or irritant reactions documented that we have used